All right, so we got Adam here. Adam, we're going to start today by going over some upper body reflexes. So we're going to start here. I'm going to start on his right side. What I'm going to do is go for biceps reflex, which is going to be C5. Perfect. That's a 2 plus. Other side, same thing. Pretty pronounced too. Thank you. All right, we've got a 2 plus on that one as well. Next one we're going to do is brachioradialis. So I'm going to bring back in the same position. I'll just stay on the side so it's easier. And then what I'm going to do, just going to rotate over, use my blunt edge of the hammer. And that's 2 plus. Same thing for over here. Perfect. And then I'm going to have you just stick one hand on your hip. We're going to go for triceps next. Going back to that pointy end, I'm going to tissue slack out here. Perfect. There's 2 plus. Two plus there. Excellent. Then we got finger flexors. This one's pretty hard to elicit, but we're going to give it our best shot. And other side, same thing. Tough to say. I'm going to assume, based on the other ones, probably a 2 plus. The next one here, we have inverted supinator sign. So what I'm going to do is I'm going to use my hammer again, and I'm going to have my patient in the pronated position. And what I'm going to do is I'm going to get towards the styloid here, and when I elicit my strike onto that styloid, what I'm looking for is for it just to basically radial deviate. And if it were a negative test, or a positive test, sorry, you would see kind of like a spasming of the fingers. So what I'm going to do is strike that there. I'm seeing a normal response here. If I were to see an abnormal response, it would look like a condition such as ALS. Perfect. And then next thing here, we are going to be going to the final phase or final position of a T6 that's left rotated with right lateral flexion restriction. So I'm going to have Adam lay face down. I'm going to go from inferior angle of the scapula to get onto T6. I'm going to use my cephalad hand. I'm going to go counterclockwise on that transverse process to establish some torque. Have my patient take a deep breath in, follow that out, and then impulse at the bottom, try and create a lack of that right lateral flexion and make sure we got that back to neutral and more right rotated. All right. Same on the shoulders. I'm going to have you lay supine, so it's good. So what we're going to do with this one here is I want to evaluate and make sure that the shoulder is it has an internal rotation restriction. So what I'm going to do is I'm going to just gauge it right away and just see where the elbow or the shoulder is popping up off the table from that position. I want to compare it side to side just to see which one has more need or deficiency. He's right-handed, so the right arm is a little bit more internally rotated, but we're going to set up on this side because it's easier. What I'm going to do here is get myself in a position here. I'm going to rest kind of his arm on my leg. I'm going to grab at the humeral head, create a little bit of space. I'm going to internally rotate until I feel that we run out of space, and I'm going to impulse and establish more internal rotation since there's restriction. All right, next one, Adam, I'll have you sit up towards the front of the table here. And we're going to go through, we have a restriction of the lunate going A to P. So what I'm going to do is I'm going to find the lunate. And then from that position, it's just dorsal or to the Lister's tubercle. And what I'm going to do is I'm going to create a little bit of separation here, but I'm just checking if it's poking back at me as I go in from flexion to extension. So if it does, I'm going to have my patient lean away. And through the window, I'm going to basically just ulnar deviate and try and push that lunate back Next one, TL junction. So we have an extension restriction. So the way I would evaluate that, I would have Adam staying here. What I'm going to do is going to just kind of rotate back here to create a little extension. Have him just kind of relax his shoulders. Use a pincer grip on that TL junction. I'm just going to assess springiness in the back there while he's in extension. If I were going to go through an adjustment here with final pose, what I'm going to have him do is I'm going to have him give himself a big hug. Perfect. And then I'm going to establish the TL junction location there. If I had a thoracic board, I would use the thoracic board. It's going to help the adjustment along. And then from that position, I'll have him tuck his chin down towards his chest a little bit. It's a little too much. Then we're going to go back after he takes a breath in. And then I would drop down with the body drop on top of that, trying to get rid of some of that extension stacking. All right, internal rotation restriction of the hips. I'm going to have him lay back supine. And so this one here, I wouldn't want to do this if I had somebody who was a potential osteoporotic individual. I'd want to use this with more of a youth athlete or middle-aged person who doesn't have any complications with ankles, knees, or hips. What I'm going to do is I'm going to establish some internal rotation by turning the leg in or the foot in. From that position, I'm going to have Adam just kind of hang onto the table here because it is slippery. And as I create some long axis here, I'm going to impulse at that end range where he's lacking that motion. A to P glide fibular heads. I'm going to have him flip over. And for this one here, we're going to say that it's his right leg. What I want to do is establish that the fibular head is here, and it's not allowing us to go into as much flexion as we would like. So what I'm going to do there is I want to establish my pisiform on that position. And what I'm going to do, so my pisiform is on his fibular head. I want to tension out, and then I'm just going to apply P to A pressure, pisiform into that fibular head. Oop, I lost it. Thank you. All right. Evaluate for internal external flexion restrictions. First, MCP. Okay. So for the MCP, what I'm going to do is I'm going to take the thumb. I'm going to stabilize. What I want to do is I want to go flexion, extension, internal rotation, external rotation. I just want to evaluate all the motions there. If I was lacking one of those motions, what I'd want to do is I would want a long axis distraction on it. And then from this position here, you would go into extension there, flexion there, or you'd go all the way out into external rotation, give it a little bit extra with an impulse, long axis, internal rotation to address that for lacking motion in any of those directions. Okay, and then I'll have Adam stand up. I'm going to have you stand back here for me. We're going to assess lower extremity nerve roots. What I'm going to have you do first is kind of turn your feet in, and I want you just to walk on your ankles towards me, assessing L4. Perfect. And then I'll have you turn around. And actually, I'll have you step it right back to where you started. We'll have you end with the... So this on here, I'm going to have you lift your toes up. Just the big toe, sorry. Just the big toe, perfect. And then we're going to have you walk on your ankles towards me again. So we're assessing L5, that is extensor hallucis. And then we're going to have you walk back on your tippy toes, both feet, back to that starting position. Perfect, and that was for S1 nerve root there.